So today I want to talk about SSRI alternatives. What is an SSRI? It stands for Selective Serotonin Reuptake Inhibitor. So what is this selective serotonin reuptake inhibitor? What's happening? Well, if you look within the neurons, we have a release of serotonin going on from one point to another. Serotonin is a neurotransmitter. It's like a message or a communication between one neuron to another through a synapse. So serotonin is released and it travels to the other side where it's received. So a lot of the serotonin is recycled because the body is very efficient. But with an SSRI, that recycling gets blocked, thereby increasing serotonin in the synapse temporarily. So these SSRIs are mainly for depression, anxiety, OCD, and sometimes for things like post-traumatic stress syndrome and a few other conditions. Now, there's some slight minor complications when people take this medication. First of all, it increases thoughts of suicide. It increases the risk of bone fractures, restless leg syndrome, jaw spasm, loss of libido, numbness in your genitals, loss of function in your sex organs. In fact, it exists in 36 to 98% of people who take this medication who are diagnosed with depression. It can also increase the risk in violent acts, GI, gastrointestinal bleeding, and cardiac heart disease. So as you can see, there are a tremendous amount of side effects with these medications. So are there some safer alternatives? Absolutely. But before I tell you this, I just wanted to mention that you always want to check with your doctor before coming off any medications. In fact, you want to work with your doctor in this transition. But the following items I'm going to talk about can have a huge impact on decreasing depression. Number one, St. John's wort. It's been used for centuries, okay? In fact, it mimics the mechanism of SSRIs. It can decrease cortisol, and it also increases other neurotransmitters. And the nice thing about St. John's wort is that it's a plant, and it has a lot less side effects because it not only is an SSRI, it provides other benefits as well. Because anytime you're using one drug that has a very specific function, it's going to then alter a lot of other functions in the body as a cascading effect. Number two, vitamin D, which has very powerful effects to help someone with depression. Number three, fasting. In fact, I did a whole video just on this one topic. Fasting can greatly elevate your mood. So you definitely need to start with intermittent fasting and then some periodic prolonged fasting. Next one is SAMI, which has been demonstrated in over 45 clinical trials, okay, that has shown significant benefits for depression. Number five, omega-3 fatty acids. But you want to make sure you increase omega-3 fatty acids by 5 times the recommended dosage to create the effect that you want. And number six, make sure anytime you're taking any remedies, also take the B vitamins like folate, B12, the entire B complex to reduce any potential side effects which can occur when you're trying to block certain neurotransmitters. A couple last points. When you're taking St. John's wort, if you have fibroids, you might want to not take it because it can actually make them worse. And then the last point, and something that's very, very important, you want to be doing healthy keto, lowering your carbs. That alone can greatly improve your mood. If you're new to my channel, I put the link down below. Check it out. Hey, before you go, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.